between September to December, 115,730 tourists came into the country. For every tourist to be allowed into the country, on top of a negative PCR test that you took 72 hours prior to your journey, you needed to take a rapid antigen test at the airport, which would cost you at least $150. Who are the people who were contracted to do this testing? Frontier Healthcare Services. They got this through sole bidding, to mean it was only Frontier Healthcare Services that were available to do the job. When at the airport you pay your $150, it goes to First Atlantic Bank. You get the notification, First Atlantic Bank receives the money, then you're able to do your testing. Let's move on. In the first 4 months leading to the end of 2020, Frontier Healthcare Services made a total of $17,359,500, all going to First Atlantic Bank. Refreshingly different. Which was refreshingly different? I mean, if you're a bank and you're holding this kind of money, I'd be happy if I was them. Of this money, some of it was to be divided between the Ghana Airport Company Limited and Frontier Healthcare Services. Before we move to that, in 2021, 632,163 visitors arrived into the country at $150 testing at the airport, and Frontier Healthcare Services made a total of $94,824,000. Of the profits made by Frontier Healthcare Services, per the contractual agreement, Ghana Airport Company was supposed to receive $10 of royalty per each test done, leaving them with $140. This means that Ghana Airport Company received $1,167,300 for the same period as royalties accruing from testing COVID-19. This also means that just in 2020 alone, Frontier Healthcare Services retained $16,202,200 from its services from September to December. Let us look at 2021, where Ghana Airport Company Limited made $9,482,445, while Frontier Healthcare retained $85,342,005. Now, we can say this is their gross profit, but this would be ill-advised, because when you're doing business, you have expenditure. Expenditure number one when you're in the healthcare business, buying of test kit. The cheapest rapid antigen test, which they do at the airport, costs at least $1. The most expensive kit cost $4, and this is according to UNICEF. This means that if we calculate $4 times the over 600,000 tourists that came in, Frontier Healthcare Services spent $2.5 million acquiring test kits. Moving on, they had other expenditures. Doing business in a foreign country, you'll need to pay corporate tax at 25%. This means that they spent a total of $23,706,112 on taxes. They also paid rent, which we reached out to Ghana Airport Company Limited to ask how much rent went into the premise, but they were not willing to comment on it. Minus the rent, the total expenditure for Frontier Healthcare Service was $26 million, leaving them with a clean $59 million to run other expenses, and what is left is profit. If you ask me, I'd tell you this is good business amid a pandemic. But there are questions. Number one, why was it sole bidding? Number two, 2 years into the pandemic, why is testing still $150 at the airport? And question number three, which is most important, while governments are aggressively vaccinating people, why do I need to do a PCR test before I come into Ghana and do another at the airport? The answer is simple. It's good business. That's all we had for you on business.